Good afternoon, everybody, and welcome to the Electronic Nicotine Delivery System, or ENDS, Vaping Summit Series. My name is Neil Sharvat. I am Director of the Tobacco Prevention and Control Program at the North Dakota Department of Health. This is the first of 4 presentations relating to ENDS use issues in North Dakota. The ENDS Series 2.0 is a continuation of the original ENDS Summit held on May 8th and 9th, 2019 in Bismarck. This was an in-person event to expand ENDS education efforts. The meeting included attendance by public health staff, tobacco control partners, and community members from across North Dakota. Day 1 focused on education from local, state, and national experts on issues relating to ENDS epidemic affecting North Dakota and the United States. Day 2 helped integrate Day 1's education and action by tobacco control partners to assess North Dakota's ENDS response efforts and adjust our North Dakota Comprehensive Tobacco Prevention and Control State Plan. We received positive feedback from summit attendees. TPCP, Tobacco Prevention and Control Program, intended to follow up with ENDS Summit 2.0 in late summer 2020. We're all painfully aware of how COVID-19 has affected everyone's lives, especially anything related to in-person meetings. The Tobacco Prevention and Control Program thought it's still vital to continue ENDS prevention efforts. Pulmonary vaping illness and COVID-19 health issues had demonstrated that ENDS prevention issues needed to continue. We needed to identify a way to continue our ENDS Summit efforts. The Tobacco Prevention and Control Program is again working to partner with Tobacco Free North Dakota and other tobacco control partners to bring the ENDS Summit series starting now. There are 3 additional presentations on December 3rd, 8th, and 10th. And just a reminder, the December 3rd presentation has been scheduled for 10 a.m. to noon Central Time. All others are 1 p.m. to 3 p.m. It's my pleasure to introduce developmental psychologist, Dr. Bonnie Halpern-Felsher. Dr. Halpern-Felsher is affiliated with Stanford University, where she is a professor of pediatrics and adolescent medicine, director of research, Division of Adolescent Medicine, co-leader, clinical scholarly concentration, residency program, Department of Pediatrics, director of fellowship research, Department of Pediatrics. Her research has focused on cognitive and psychosocial factors involved in adolescents and young adults, health-related decision-making, perceptions of risk and vulnerability, health communication and risk behavior, including understanding and reducing health risk behaviors such as tobacco use, alcohol, and marijuana use, risky driving, and risky sexual behavior. She is part of the Tobacco Centers of Regulatory Science, and she is a primary investigator on an NIH, NCI, and FDA-funded longitudinal study examining adolescents and young adults' perceptions regarding initiation, continuation, and cessation of current and new tobacco products, including e-cigarettes and smokeless tobacco. Dr. Halpern-Felsher is also a founder and director of Tobacco Prevention Toolkit, an online curriculum aimed at reducing and preventing youth tobacco use. Her research and contributions to tobacco prevention has influenced national policies regulating adolescent and young adult tobacco use. Welcome, Dr. Halpern-Felsher.
Hello, hi everyone. And I want to thank the organizers for inviting me to present to you about why adolescents are vaping and what you can do about it. So my name is Bonnie Halpern-Felsher, professor, and I am the founder and executive director of the Tobacco Prevention Toolkit. I do want to give a quick shout out, especially on this Giving Day, Giving Tuesday, to all of our funders and donors who have really allowed us to keep the work that we do going. I also want to make sure and shout out a couple of disclosures that I have. One is that I am an expert scientist in some e-cigarette litigation, and second, that I am an expert for some city, state, and federal level policies around e-cigarettes and tobacco overall. So I want to start off today first talking about the national data and why we're so concerned about electronic cigarettes or vaping. And by the way, you'll hear me using those terms interchangeably. I want to know, I tend to use as a public health person and a researcher, e-cigarettes or electronic cigarettes, not vaping. These products are not vaporizers, they're aerosol. or aerosolizers. And really the whole reason to call them vaping, we think, was put on by the industry so people don't equate these products with cigarettes, but they are electronic forms of cigarettes. So you're probably hearing me say e-cigarettes more often than vaping. Anyway, why are we concerned? So if you look on the far left, first of all, the good news on this panel. In the far left, you see the percentage of adolescents who've reported using a cigarette in the past 30 days. And these are national data from the National Youth Tobacco Survey put out by the CDC. And you'll see starting in 2011 on this, that about 15% of adolescents reported past 30-day use of a cigarette. And that number went down dramatically over the following 8 to 9, 10 years, where we see well under 6%, single digits of adolescents reporting, and these are high school students reporting past 30-day use of cigarettes. That's the really great news. The not good news is what we see on the right. We see a very sharp increase in the number of adolescents reporting using an e-cigarette or vaping device in the past 30 days. And what we see is a particular uptick in 2018 and 2019, where we went from down around the teen numbers shot up to almost 21% and almost 28% of youth reporting use. These numbers represent a 78% increase in the percentage of high school students reporting electronic cigarette use and a 48% increase in the number of middle school students reporting such use. Now, I do want to point out a couple of things. First of all, very important to know these percentages and these rates of adolescent e-cigarette use has nothing to do with race, ethnicity, gender, socioeconomic status, geography. It's an equal opportunity bad thing going on right now. Teens just across the country, everywhere, are using these products. Second, when you look at this graph, I want to make sure you realize that the increase in e-cigarette use is not the reason why we see a decrease in cigarette use. Cigarette use was going down regardless. E-cigarettes did not help the youth go away from cigarettes. The increase in e-cigarette use is regardless. And that's important because I get a lot of people who say to me, oh, thankfully we have e-cigarettes or we have teens using cigarettes. That's not the case. Teens were not going to use cigarettes regardless. So we really do have an e-cigarette or vaping epidemic, as we've heard from our Surgeon General and the former FDA commissioner. So we have even newer data that just came out in the last few months. The YRBS, the Youth Risk Behavior Survey of 2019, showed almost 33% of youth reporting past 30-day e-cigarette use. And then you could see the numbers are well below 10%, 6% and under really for cigarettes, cigars, and smokeless tobacco across the country. For the National Youth Tobacco Survey, in the past few months, we saw brand new numbers for 2020 that are showing that current e-cigarette users have actually gone down to about 20%. That's really great news. But I will point out that 20% versus 28%, while a significant drop, it's still 1 in 5 teens who are using an e-cigarette in the past 30 days. It's still over 3 million youth in this country. More importantly, these data were collected just at the start of COVID, January to March, when youth were starting to become more aware and concerned about lung health, and we'll talk about that a little bit later. And so we don't know if these numbers are going to continue to go down, and a lot of us are concerned that we're going to see an uptick in e-cigarette use again once youth are less concerned about lung health, less concerned about COVID, and start going back to school and congregating again. So when we talk about e-cigarettes, what are we talking about? You'll see the pictures before you hear of the various products, and I'm going to go through these and explain a lot more about e-cigarettes and e-cigarette products. First, when we talk about these, we tend to talk about them as generations. There are iterations of electronic cigarettes that have come about. E-cigarettes first came on the market in the US in 2007. When they first came on the market, they were these on the far left that you see. They look like cigarettes. We tend to call them cig-alikes. They were small, very much in the shape, sometimes even in the color of a conventional combustible cigarette, but they were electronic. They resembled the cigarette and they were disposable. So once you use these products, you could throw them away. They had nicotine, although some had no nicotine in them, but most of them had some nicotine, not necessarily a lot of nicotine, and they weren't very good at delivering nicotine to the body and particularly into the brain. Teens weren't using these products very often. They look like cigarettes. Teens didn't want to and don't want to use cigarettes. A few years later, we had the middle box here that you see that looks like a pen. These are called vape pens or pen-shaped or vaporizers, and these were larger and rechargeable. So when you're done with these, you would charge them in the wall. And when I go around talking to teens and to parents and schools, educators across the country, they would tell me, oh, we would see teens putting something into the wall to charge it. We didn't know what it was. They were generally a vape pen here. Teens started using those, not a huge uptick, those in that second generation. Then we have the third generation that you see here that look like a box. And it's a box with this tube on it, and you breathe that in, and that's where you would breathe in the nicotine and the other chemicals. These are tended to be referred to as mods because you can modify the entire product, the device. You can modify the coils, the cotton, how much nicotine, how much liquid you put into it, the volume, the voltage, the heat, all that can be customized. And then they're refillable. So when you use up the e-liquid, then you just drip it or pour more in and continue to breathe it in. So that's why they're considered to be refillable. So when I talk about e-liquid or e-juice, let me show you the anatomy of an e-cigarette. This is the older ones, but the first three generations worked pretty similarly. They have a battery, they have an atomizer or a coil, they have some absorbent material that has the chemicals in them, and we'll talk about the chemicals more in a minute, and then you breathe in the aerosol. And again, it's important to realize it's not a vapor, it's an aerosol. And when I go around and talk to teens, I make sure they realize it is not a vapor. A vapor, a harmless vapor, is water vapor. These are aerosols that do have the chemicals within them. So when I talk about e-liquid or e-juice, what am I talking about? You see them before you here. These are bottles. They're about the size of eye drops, and they contain the e-juice, the e-liquid, has flavors, has nicotine and other chemicals in them. And these are the bottles that you would then take from here and pour them into your e-cigarette device, the earlier generations. These have very high concentrations of nicotine, so much so that one of these bottles can kill an entire class, if they drank it, of kindergarten students. 1 teaspoon can kill a small adult. That's part of the problem. They also smell good, and we'll talk about flavors in a few minutes, but they smell good. And there was a big uptick in reports to the poison control, particularly the CDC, because little kids thought that they were candy, they smell good, and were drinking some of these materials here, these e-liquids. All right. Then came the fourth generation, and that's where we started getting the most concerned, and I'm sure you've heard about it. It's called Juul. This on the far right. These are sleek, discreet. The boxes, the ones on the left, a little bit, they're pretty big. They're hard to hide. These newer devices, they're sleek, discreet, they're high-tech, and very high in nicotine, more than the other products, and I'll show you how much in a minute, okay? So a lot of us have referred to this as a juuling epidemic. Why? When we saw that uptick in 2016, that corresponds, even though Juul came on the market in 2015, the big increase started happening towards 2016 and then into 2017. And what you see here is a slide from the Public Health Law Center in California. And you can see below these, the smaller lines are the other e-cigarette products that were on the market. The blue big mountain you see are the total market share of all e-cigarettes that were sold during this time period. And the red is the proportion of that blue that was from Juul. Juul had about 75% of the e-cigarette market. They still have a significant majority of the e-cigarette market. That's why when you hear people say it's a juuling epidemic within this vaping epidemic, it's because the majority of people who were using e-cigarettes were using Juul. Now, with Juul's rise of popularity, we found that a lot of other companies followed suit, and you'll see here that this is speeding up on purpose to show the quick proliferation of other e-cigarettes that came on the market that look like the Juul. And these are referred to as pod-based. And pods, because, and I'll show you in a minute, there's this top piece that's the pod that can come off. So let me show you. And you can see they very much look like USBs. So when I talk about the anatomy of a pod, this is what I'm talking about here. These pods, you buy the device and then you buy the pods, and these pods on the right have the liquid and have the nicotine in them and the chemicals and the flavors, and you pop it in very easily into the device and then breathe it in. So this is basically what the anatomy looks like. They also have a battery. The Juul and the other pod base are rechargeable into your USB in your computer, very easily recharged. These also come in colors, and the colors match the flavors. And it's important to note, by the way, all of those products have nicotine. Now, more recently, we've had this, what we've been calling the 5th generation, these disposables. So what you see before you here is a picture that I took actually of a bag of products that a health educator in California gave to me, of all the products that they confiscated from their school before COVID. And I laid them out on the table and took a picture, because what I found most interesting is this close up here, which is that most of what the teens were using now, more recently, are these puff bars. These look like the Juul, except for they don't have a separate pod. They're all one piece. They still resemble a USB. They still come in beautiful colors. If you've ever touched one, they feel really smooth. They fit nicely in the palm of your hand, very colorful, lots of flavors in them. These are referred to as disposables, not the 1st generation disposables, but 5th generation, higher in nicotine. But when you're done with these, you also would throw them out, which has a whole nother issue around environmental impact that we're not going to actually go into today. Now, importantly, while I mentioned earlier that the National Youth Tobacco Survey data were showing that we have a decrease in the percentage of adolescents using e-cigarettes overall, what we have seen is an uptick in the percentage of youth who are using these disposable e-cigarettes. And we'll talk about that a lot more when we get to advocacy in a few minutes. But these disposables really are being used a lot by youth, and we have some data suggesting the same. So what's in an e-cigarette? What we see is a number of chemicals that are in these products. And, I've been doing tobacco control work for 25 years, starting with cigarettes and youth. And these are the kinds of slides that I would show when I'm talking about tobacco overall, and particularly cigarettes. Well, cigarettes have thousands, e-cigarettes can have hundreds of chemicals, and we're seeing pretty similar similar chemicals. We're seeing formaldehyde, we're seeing acetone, we're seeing nickel, we're seeing cadmium and lead, not that different, cobalt, not that different from what we had seen with cigarettes. Now, e-cigarettes have glycol and glycerin and a lot more flavoring, so we'll talk about that soon. But a lot of the other chemicals are there, we just have fewer of them. So let's also talk a little bit about the different kinds of e-cigarettes. Let's compare the 3rd, 4th, and 5th generation. So the one on your right is that 3rd generation, the mods, the box style that youth again were using, not nearly as much as they're using the newer products. And then let's talk about the pods and the disposables. And why am I so concerned about these newer products, the Juul, the pods, and the puff bars, the disposables? The first has to do with the type of nicotine. So the older, if I can say that, they haven't been on the market that long, but the so-called older products, the older e-cigarettes and cigarettes, by the way, use a free-base nicotine. What is a free-base nicotine? Free-base nicotine has sugars and ammonia added to it to basically be able to allow it to bind and come through your body faster and into your brain. That's what they bind with it. THC, for example, uses vitamin E acetate. We'll talk about that in a few minutes. Free-base nicotine uses ammonia and sugar. If you've ever been a smoker, I haven't been, but a lot of people have told me, you breathe this in, a cigarette or the older e-cigarettes, and because of the materials that's in there, the chemicals, you tend to get a throat hit. It would be sharp and kind of painful in the back of your throat. Now, if you are an adult who's been using cigarettes for a long time and you switch over to an e-cigarette with the free-base nicotine, you're not going to care about the throat hit. You're used to it. But if you're a teen who's never used an e-cigarette, never used a cigarette before, which again, most teens who start using tobacco now are starting with e-cigarettes, not cigarettes. So if you start with this free-base nicotine, you're not going to like it very much. Part of why teens didn't have a big uptick in use of these products. take on the left, these newer products have a salt-based nicotine that was patented by Juul. The salt-based nicotine uses benzoic acid to change the pH balance of the product. So when you breathe it in, it's not as acidic, it's not as painful. You don't feel that throat hit. So again, if you're a new user to tobacco and you use a salt base, you don't cough as much, doesn't bother you as much, it's smoother, and it's able to reach the brain very quickly. So that's a huge difference in why we think teens are using them so often. I talk to teens who say that they're just using it around the clock. It's really the first product, the ones on the left, that teens could just put under their pillow and wake up in the middle of the night and take a few hits and go back to sleep. So like our iPhones, so you can wake up and check your mail or whatever in the middle of the night. The other big difference is the amount of nicotine. The newer products, the fourth and fifth generation, the pods and the disposables have almost double, if not more than double, the amount of nicotine that's in the older products. And we'll talk about that in a minute. The other important piece is, like I said before, the ones on the right were made to be refilled. The ones on the left are not made to be refilled. You can buy a new cartridge for the pods, but you're not adding liquid to it, the e-liquid. Having said that, a pretty easy, quick look at YouTube will tell a person, and there are young adults doing this, and teens will tell a person how to break apart these products and add in new e-liquid or to add in marijuana. And we actually published a study last year showing about 20% of teens in our study were putting marijuana, the wax and liquid into these products. All right, so I said I would tell you how much cigarettes or how much nicotine is in these products. Well, you probably know that a pack of cigarettes has 20 cigarettes in them. What you may not know is that a cigarette has 8 milligrams of nicotine. But cigarettes, while they're the best at allowing that nicotine to go through your body and into your brain, which takes about 7 to 10 seconds, while they're the best delivery system for the nicotine and the other chemicals, they're not necessarily efficient in terms of the yield of that nicotine, meaning that even though it has 8 milligrams of nicotine, what you actually breathe in is closer to 1 to 1.5 milligrams of nicotine per cigarette. So if you just do the math on that, a pack of cigarettes has maybe 20 plus milligrams of nicotine if you smoke that whole pack of cigarette. Now, Juul has 41 milligrams of nicotine in that little pod. It's very little, okay? It's 41 milligrams. If you just simply do the math, because Juul says that the yield is almost all of it, at least 80% of the nicotine goes into your body. So if you just do the math on this, a Juul pod has around 41 cigarettes worth of nicotine. Now, some people say it's a little bit of an overestimate. Some people say it's equivalent to a pack. We'd say more like a pack and a half to 2 packs of cigarettes, but whatever, it's a lot of nicotine in that small pod. The new puff bars have more nicotine, 50 milligrams, so it's even more cigarettes worth of nicotine. And a Soren, which has just higher volume in there, has about 90 cigarettes worth of nicotine. Now, how much are teens using? When we talk to teens, they'll tell us that they're using anywhere from a pod a day to a pod a week. Teens who are addicted are telling us 1 to 4 pods a day. That's anywhere from 1 to 8 cigarette packs a day. It's an insane amount of nicotine that young people are taking in right now, and they are becoming addicted, and they are showing signs of addiction. And importantly, all of these newer products, the Puff Bar, Juul, the new pods, the new disposables, have high amounts of nicotine. You're not finding a zero nicotine product. But teens are confused. They still think that these products don't have nicotine or chemicals, but they do. So why are we concerned? Let's talk about the body when we're vaping. So probably a lot of you are healthcare providers, you know this, that the brain during adolescence and into young adults until about the age of 25 is changing. Our brain is pruning away the parts, the synaptic connections, the parts of the neural connections that we don't need, and myelinating or sheathing over the parts that we do. So we become more efficient in our brain and in our thinking and processing of information. That's happening during this time period. While this is happening, the brain is kind of looking around saying, what receptors in the brain, what receptors, what neuronal connections do I need, and what should I prune away and get rid of? Well, if you have not introduced nicotine into your body, your brain says, oh, well, I guess I don't need those nicotine receptors, because here's what people don't realize. We're born with the ability to become addicted. We're born with the nicotinic receptors. So the body is saying, what do I do with these in my brain? If you don't use them, don't introduce nicotine, they go away. And we don't worry as much, which is why I'm not saying that starting at age 25 or so, go ahead and have a good time using nicotine or using tobacco. Of course not. But you're much, much less likely to become addicted if you start in middle to later adult time period. Teens and young adults are when these changes are going on, and if you introduce a drug, you're much, much more likely to become addicted to it. So that's important. And the nicotine actually changes and rewires the brain. The other is that we know that nicotine, there's studies showing that it actually makes the heartbeat faster. And e-cigarettes, there's research showing that e-cigarettes do have an effect on the heart and also the lungs. And let's stop and pause and talk about the lungs for a few minutes. So pulmonary effects. First of all, the flavorings, and we'll talk more about the flavorings in a minute, but there are flavors and flavorings in these products. We've got diacetyl, which is the buttery flavor that we see in microwave popcorn. We have vanillin, a vanilla flavor, or cinnamon aldehyde, a cinnamon flavor that is an aldehyde, and that is a carcinogen, but it's also harmful to the lungs. We know through many studies that these flavorings can harm the lungs, both in animal and human models, causing respiratory illness, bronchitis, potentially life-threatening respiratory failure. And we know that there's a term by the federal government called GRAS, generally recognized as safe. Look, you can take a Cheeto, you can take, T-bone steak or cinnamon or butter and heat it and then eat it. But if you take it and heat it to 300-400 degrees, which is what's happening with these e-cigarettes, and then breathe in the resulting aerosol, which is what you're doing, that is where it's not safe. So you can eat something, but not inhale it. And that's where we're seeing a lot of the problems just with the flavors themselves. And again, there are studies, including a couple studies out of Stanford, where I'm from, really showing that these flavor rings themselves impair lung and heart function. Okay, and this is important when we're talking to teens and advocates and others to try to explain where, teens will say, well, there's no nicotine in this product. Well, first of all, there probably is. But even if there was no nicotine, I'm still worried about you just breathing in the flavors themselves. And I get a lot of teens who say, it's just flavored water. Well, it's not. But again, the flavors themselves are concerning. Now, you may have heard of EVALI. It's the e-cigarette or vaping associated lung illness. And we heard a lot about this before COVID at the end of 2019 and into early 2020, where teens and adults were using some form of vaping device and they were getting sick, and we had some deaths. So we have almost 3,000 cases that were reported by the CDC as of February 2020, almost 70 deaths. It's important to know that the CDC stopped counting EVALI. Unfortunately, EVALI cases, even though I hear from a lot of pulmonary docs, my friends in pediatrics and hospitalists who are saying that they're still seeing cases of EVALI, but the CDC is not recording it anymore. Now, the question is, are people who are getting sick using e-cigarettes, nicotine products, tobacco products, or are they using THC? And it seems like a lot of the EVALI cases were due to THC, but not all. So jury's still out on this, and it's something that we need to pay attention to. But we also are starting to build some evidence about smoking and vaping COVID. We do know that when you smoke or vape, you do weaken your lungs overall. And the coronavirus does attack the lungs. So it stands to reason that if you are smoking or vaping, you could be more at risk of having severe disease. There's a lot of mixed data on this, and jury's still out, but it just makes common sense that if you're doing something that hurts your lungs during a time when we've got a pandemic of a lung disease, that's probably not a good idea. Now, we published a paper you may have heard about in August of this, just a few months ago in August, where we did a study of 4,500 adolescents and young adults 13 to 24 years of age across the country who did a survey, and we asked them about what e-cigarette products they were using, whether they were using any products at all, whether what other tobacco were they using, what flavors, what kinds of products. And then we asked them, have you had certain symptoms? And we named them, particularly COVID symptoms. We asked them, asthma and all kinds of other symptoms as well. We asked them whether they had ever been tested for COVID-19, and then if they were tested, whether they were positive for COVID-19. And what we found in this study is that adolescents and young adults who were using both e-cigarettes and cigarettes in the past 30 days were almost 5 times more likely to have symptoms of COVID. In testing, they were 3 to 4 times more likely to be tested if they had ever used either an e-cigarette, a cigarette, or both products. They were 9 times more likely to be tested if they were a dual user in the past 30 days, and almost 3 times more likely to be tested if they used in the past 30 days. And then they were more likely to be diagnosed with COVID, controlling for all the other factors, including gender, region, race, ethnicity, making sure that they were tested as well as positive. And they were 5 to 7 times more likely to be testing positive if they had ever used an e-cigarette or if they were dual users, and 7 times more likely if they used in the past 30 days, both e-cigarettes and cigarettes. Now, there's been some question about, well, why are we concerned about vaping when it's also cigarette use? Again, teens are starting with e-cigarettes. Teens who start with e-cigarettes are often then more likely to go on to use cigarettes in the past 30 days. We found is in the past 30 days, teens were using any tobacco product they can find, especially if they were addicted. So while they start with e-cigarettes, and that's the most concerning product of use, by the time we did the study and asked them about past 30-day use, most of the teens who had used an e-cigarette ever in their life in the past 30 days had used both products. And that's why we say, well, both products seem to be concerning. We're particularly concerned about vaping because that's the initiation product for teens. Now, why are we seeing this relationship between vaping and COVID? It could be that we're seeing this relationship because of the lung illness that I mentioned, but we also think we're not talking about severity in this study. We're talking about exposure, being diagnosed. And what we think is happening is, look, teens share their vaping products. We know that. And even though the majority of teens in our study were so-called sheltering in place, they could easily be in their backyard with friends, sharing their device. And that is a way of exposing themselves or increasing their exposure to the virus. Also, when you're vaping or smoking, you take your mask off, and thereby exposing yourself more to the virus potentially. The other is the hand to mouth. You touch a doorknob, you touch your vaping device, you touch your mouth, and you're delivering the virus to yourself that way. And then finally, there's the question of whether that big plume of aerosol could also carry the virus. We originally learned that the virus was carried by spit, by saliva, but now there's also data suggesting that the virus is also carried by an aerosol. So if you're creating that aerosol in the air, that might have the virus that you're then breathing back into your body or into somebody standing next to you. We also know, as I was saying before, that if you start with an e-cigarette, you're 4 times more likely to go on to use a cigarette, and then now you're having all the same symptoms and risks overall. I'm not just talking about Ebola or COVID, just overall for cigarette smokers. So why are youth using these e-cigarettes? Well, there are a lot of different reasons, but we're going to focus on 5. Flavors, the fact that it's easy to hide or conceal, marketing, access to the products, and misperceptions. So I'll spend a few minutes on flavors. All right. If you look at, again, the CDC and NIH data that were collected in 2019, where teens were asked, why are you vaping? You'll see that the second most important reason was because it tastes good. And we have data in our lab as well that we've published to also show this. Because it tastes good, they like the flavors, and also with the flavors comes the good smell. So if you've ever been near somebody who's using an e-cigarette, I have a relative who used to use, it smelled good. It smelled like caramel. When I was near, I was never too close to him because I didn't want to be exposed to it, but if I was in his vicinity, it smelled good. It's really easy to hide these products and hide the smell or hide the use because they smell good. And that goes along with the tasting good as well. So why flavors? Well, flavors mask the harsh taste of tobacco. They also mask the smell and make them easier to hide because, like I was saying, they don't smell like tobacco used to smell. I often tell parents, if your kid's room is smelling like strawberries, bananas, blueberries, peaches, I don't think they're eating fruit salad. They may be using a nicotine device, an e-cigarette device. The flavors also mask the risks of the tobacco product. So if it smells good and tastes good, teens think it must not be a bad thing and it must be okay because it doesn't smell or taste like a cigarette. And then youth are definitely, lots of data showing that youth are more likely to report interest in trying a tobacco product if it has flavors. Also, teens say that they would quit using the device if flavors were not available. We also know that the ads and the packaging of flavors are very appealing to youth, and I'll show you that a little bit more. And that no matter what the flavor it is, if youth will switch products, tobacco products, until they find flavors. They're very attracted to those flavors. So think to yourself while I show you this picture, how many flavors do you think there are across all the e-cigarette devices? If we were live, I'd have you shout it out, but think to yourself. There are over 15,000 unique flavors of e-cigarettes across. Now, not Juul. Juul has about 7 or 8, but they have the key ones, mango, mint, menthol. But across the board, there are all these flavors. Now, I hear from a lot of e-cigarette companies or users of e-cigarettes who say, wait, these flavors are for adults and to help adults quit smoking. Well, that's certainly not the case. If you look at these flavors, things like honey doo-doo or dragon's blood or sugar booger or unicorn poop, these are not flavors that are attracting adults. These are kid flavors. These are kid-friendly flavors. There's very few adults who say, oh, I want to try booger flavor. These are attracting our young people. And in fact, if you look at the same National Youth Tobacco Survey from 2020 that I mentioned before, amongst high school youth, 87%, 2.5 million youth in high school are using flavored e-cigarettes. And you can see they're predominantly fruit, but also mint and menthol. And we'll talk about those in a little bit. Middle school students are also using fruit, candy, mint, and menthol flavors. They're starting with and using flavored electronic cigarettes. Now, I want to talk about menthol for a minute, because a lot of times when we're talking about advocacy, people say, oh, we don't need to ban menthol. Well, we do, and let me tell you why. First of all, the mint comes from, it's extracted from, and they're sort of interchangeable, the mint and menthol in a lot of ways. It has a minty taste, tastes like candy, right? It has that cooling sensation. It has a numbing sensation. A lot of people say that menthol helps the poison go down easier because it's not as painful. The menthol activates the taste buds. It soothes the throat, and it has that numbing feeling. And you can also breathe it in deeper when it has menthol, particularly a cigarette, but really any tobacco product, because of that menthol has that cooling flavor. Menthol has no redeeming value in any tobacco product other than to make that poison go down easier. We also know that menthol is what we call in our lab a social justice issue. It's targeting people of color and people who are LGBTQ. The tobacco industry actually has a menthol plan they would talk about, and we see ads now in advocacy ads from the California Department of Public Health, great ads really talking about how the industry was very much targeting people of color for using menthol. And you can see ads here for exactly what I'm saying here, that these products and the ads for some of these cool, minty menthol flavors had African American or Black people on the ads and very much attracting them. Now, I get a lot of people who say, well, oh, okay, fine, but youth aren't using mint or menthol. Take a look at this picture here. This is a picture that a friend of mine gave me, a professor at UCSF, who did a garbology study, and he looked at, and they collected trash in the parking lot of a school in Northern California, and pre-COVID. And if you look at what's here, the majority of the colors are this greenish color. Those are mint and menthol. These are the products that were being used by adolescents. They're mostly Juul, and they're mostly mint and menthol. Now, if you look here, later, well, one is Juul did a voluntary banning of its own flavors for a while. They took all the products, all the flavors off the market except mint and menthol, and then later took mint off as well. Well, what you can see here is of all the flavors that are being used amongst adolescents, or people in general, I should say, in the United States from September 2014 to May of 2020, you can see that while the certainly tobacco flavored is going down, you can see that mint and menthol flavors went up. Okay, and then if you look here, of specifically the e-cigarettes being used at the same time period, at the same time when some of these other flavors were going down, mint and menthol, particularly menthol, went up. So you take the flavors off the market and people are just going to shift to using menthol. And teens, we know, first of all, teens can find flavors. Despite the so-called regulation of these products and the flavors, they're finding these flavors, they're finding these products. It's not very hard. They text each other and say, "Ooh, who found mango?" or "Who found mint?" or "Who found," and they can find them. But also, when you take some flavors off the market, people just go and find other flavors. So teens are using mint and menthol. I have a teen who said to me, "Of course I am. I love gum. I love mint. I love menthol flavors." We did a study in our lab where we looked at those ads for the flavored e-cigarettes. This is pre-Juul, but we asked adolescents and young adults to look at these pictures, gave them to them in a random order, and said, well, are these flavors attracting youth your age? Maybe somebody a little bit older, maybe a lot older, an adult, or somebody younger. And we asked them that. And when we found, and by the way, most of the things I'm presenting to you today, either we publish in our lab or somebody else has. So at the end, you're welcome to send me an email if you want any of these papers. But we asked teens who were the targeted audience for these flavored ads. And the purple that you're seeing here are the percentage of youth who said somebody much older, or true adult, so to speak. You can see very few. Even the appletini, the coffee, and the beer, even the ones that we would say are adult flavors, even for those, the majority of teens did not say that those flavors were for people much older. They were saying that they're for people their age, a little older, or younger. And then the cupcake man, the one that was that really pretty, very flavored, fruity, sweet-looking cupcake, oh, those were targeting people much younger than we as participants in the study. And when you also say, well, they're targeting somebody a little bit older, what teen does not want to be a little bit older? So this is not surprising that teens thought these products were for them. All right, let's talk about easy to hide. Just take a minute to see if you can see how many electronic cigarettes you see in this picture. Again, if we were live, I would ask you to shout it out. There are 6. You've got down here next to the USB, the Stig and the Juul, and they both look like USBs. Soren is this yellow one that looks like a highlighter. You've got in the container here, if you can see my cursor, the Juul pod, and then in the pencil case, you see 2 vape pens. These are very easy for teens to hide. And teens tell us that part of why they use these products is they're so easy to hide. If you look at the Juul pods, for example, and some of the other pods that are on the market, they're as small as a quarter or a small paper clip. I get parents who say, I didn't realize my kid was vaping until suddenly I'm doing laundry and one of these things pops out of their jeans. What is it? And they learn that it's a vaping product. So let's talk about marketing. The other problem is packaging. We know that when you look at some of these packaging, it's really hard to know how much nicotine is in here. The original Juul package said 5% strength. And now a lot of the packaging says 5% strength or 5% nicotine. What does that mean? When we ask teens how much nicotine are they using or how much nicotine is in a Juul, they don't know. And a lot of teens thought it was 5 milligrams because it says 5. Some people thought 50% nicotine, which is impossible. It would kill you. Teens have no idea, and part of it comes from this packaging. They don't realize what 5% means. I ask adults, what does 5% mean? Nobody realizes that that translates to 41 milligrams of nicotine in these products. So that's another problem that we're seeing. We also see these products being marketed like juice boxes and cool kinds of packaging that are very attractive to youth, particularly younger youth, really find this attractive. And they don't see, when they read these packaging, they don't see nicotine, they don't see chemicals, they don't see cigarettes or e-cigarettes. They see juice, they see flavors, they see candy. We also know that there are youth-focused ads. Juul, for example, on the left, this vaporized ad that they have, where Juul say, well, it's for adults. I'm a middle-aged woman. I don't, never smoke, but I don't go around with a Letterman jacket and my belly showing and my hair up in a high ponytail. That's for a youth. That's for a young adult. That's who's being attracted by these products. We also have ads like Juul, love, love, love my mango. Again, adults don't talk love, love, love. That's a kid language. We see social media that came out with Juul and other more of the recent products, like will you marry me, or where would I go to get Juul pod or water, and I would go for the Juul pod over the water. And then what's really sad is during COVID, a lot of the e-cigarette companies were doing ads that were youth-focused and adult-focused, I should say, but really capitalizing on COVID. Very sad, very disgusting. On the left, you've got Soren saying at the time when we could not get PPE, we could not get masks, saying, you know what, if you order a Soren, we'll send you 2 free masks. Or on the right, may the 4th be with you. During May 4th was Puff Bar, and Puff Bar was really taking advantage of teens and adults being home during COVID and saying, oh, relax with us during this day sheltering in place and use our products. Access. Let's talk about access. So if you see here, I don't know what the legal age is for using nicotine and tobacco in North Dakota, but across the country now, as of December of 2019, the legal age to purchase these products, any tobacco product, and by the way, e-cigarettes are tobacco products. The nicotine comes from tobacco. So the legal age across the country is 21. Well, when you look at a picture like this that says student discounts, the majority of people under 21 are students. Students are under 21. So this is attracting our young people. So you look at youth access data, teens tell us all the time, it is not hard to get these products. Retail stores, brick and mortar stores are selling e-cigarettes, they're selling Juul. Teens are mostly getting them from brick and mortar, although we have some data suggesting that they're actually getting it during COVID from other sources, including online, and they're not being age verified. Nobody's coming to them to say, can you show us your ID? And if they are being asked to verify their age, it's an ineffective means. Cost. I don't know about in North Dakota, but I've been finding across the country these aren't that different. A Juul device is about $35. The Juul pods are $16. A pack of cigarettes in California is $10. So if you basically think 4 Juul pods for $16, 4 packs of cigarettes for $38, Juuls are pretty cheap. They're not that expensive. And the newer products like Puff Bar are $1. So these products are very easy and very inexpensive. And we know from some of the research we've done that also teens who get coupons or promotional materials like hats and t-shirts are 2 times more likely to go on and use an electronic cigarette or other non-cigarette product if they have these promotional items. And then finally, and then we'll wrap up on what you can do, let's talk about perceptions. Teens perceive these products to be less risky and less addictive compared to all other tobacco products. Now, you might say, well, aren't they less risky than cigarettes? Well, earlier we thought maybe they were, but now the evidence is mounting that they may be different, but not less risky compared to a cigarette. But also, let's realize that teens were not starting with cigarettes. Again, so the comparison is not e-cigarettes to cigarettes for a young person. The comparison is e-cigarettes to no tobacco, to no nicotine. Some people say, a friend of mine, Brian King, a fantastic researcher in this area, and I have often said, you can jump from a 10-story building or a 20-story building, the effects are still the same. So we're very much concerned about these products. When you talk about nicotine and addiction, there's no difference, really. These products, these newer products have so much nicotine in them, teens are becoming addicted. Teens don't understand. Teens think that these products don't have nicotine. They think they're still harmless water vapor. Even today, they still think that. They think that they are fine to be using. And so we really need to work on those misperceptions. So what can you do? Stay informed. Talk to your children, talk to your patients, be an advocate. So talk about the dangers of tobacco and e-cigarettes. We did a study, a qualitative study, where teens basically said, if you don't talk about it, we think it's not a problem. And because we're not talking, well, we are now, but weren't talking about e-cigarettes, they thought they were fine. It's important to talk to parents about and others not using e-cigarettes in the house or the car or places where children and adolescents spend time. Talk with, or if you are a healthcare provider, talk about ways to help adolescents quit. And if you're using these products, don't use the liquid. Make sure that you keep these products out of the hands of pets and children because of the fact that they could ingest it and get very sick or even die from the chemicals that are in there. But they taste good and they smell good. So children, in particular little kids, think that they're just candy. How do you know if somebody is potentially using an electronic cigarette? You know, it's not that different from what we see with cigarettes in terms of withdrawal. They might be moody and irritable. Now, teens are moody and irritable anyway, a lot of times, but this is sort of a sudden change that you're seeing something different from the normal. Maybe they're not talking to family members because they're running upstairs during dinner time to take a hit, or maybe their school performance is going down. And then physical changes, we do see teens having headaches, a lot of headaches from teens who are using these products, stomach aches, they're going through withdrawal symptoms, they're actually coughing a lot, and is another issue that we worry about. So talk to teens. You know, it's not a lecture. It's not finding the right time, you know, saying tomorrow at 3 o'clock we need to talk about e-cigarettes. It's finding the time to have that conversation with them. Use the right terms. You know, again, I'm talking e-cigarettes, but that's not what teens use. Teens and young adults say vaping or juuling, so use those words. You can go and say, I just heard a talk, and I'm curious about e-cigarettes. What do you know about it? Don't come right out and say, are you using? They're not going to say yes, and they don't want to disappoint you. So start the conversation more generally. So advocacy, important. So the FDA, as of 2016, well, as of 2009, through the Tobacco Control Act, FDA was given authority through the Center of Tobacco Products that was developed through the Tobacco Control Act. They were given authority to regulate and authorize the sale of and marketing of tobacco. Early on, it was predominantly cigarettes. In 2016, e-cigarettes were what's called deemed or became part of that law. So they do have, the FDA does have the authority to regulate and enforce the law, but they haven't. They have not been doing that for a number of reasons. In 2016, the law said that soon after, and the date was set to 2018, all new tobacco products on the market, including e-cigarettes, had to file what's called a pre-market tobacco application, PMTA. They had to be authorized to be allowed to sell that new tobacco product on the market. No e-cigarette company did that. The date was originally 2018. Then the date got pushed to May of, or I don't know if it was May, but to 2022. Public health groups sued the FDA, and that date got moved back to May of 2020, which then with COVID got moved to September of 2020. So as of September of 2020, we finally do have e-cigarette companies that have filed their PMTAs. Now we're concerned about what level of authorization and scrutiny and evaluation the FDA is going to do. We've written commentary on this. If you're interested in helping, be very happy to explain how to go about doing this, because we really need the FDA to really look at those tobacco PMTAs before they authorize the sale of these products. We're concerned that whether the FDA is going to demand that these companies look at youth data, because so far they have not demanded youth data. They've been looking at adult data only, and that's very concerning because we do know that youth are attracted to these new products. In early 2020, the FDA did use their discretion to regulate cartridge-based, pod-based products, except for those that are containing tobacco or menthol flavored. So things like Juul that were not tobacco or menthol. But it didn't really have much effect because we do know that teens are still getting these products. And again, they're just moving to menthol. But the FDA did not prioritize open systems like Sorin or disposables like PEFBAR, which are very popular with youth. As I showed you, they come in the colors, they come in flavors, and they're cool packaging. Those are not right now being prioritized for the regulation by the FDA. And now it's become, we say whack-a-mole, it's become the open market, the Wild West, where teens are just saying, well, fine, I go from one product to another. I don't really care. Whatever I can find that's cool and flavored and has the nicotine, because we're going through withdrawal, we're going to be able to use. So the state and local, I'm not as up on the North Dakota, but, right now, the federal level is very, very slow. There's a lot of things that can happen at the local and the state level. We can be doing flavor bans, or better to say, eliminating the sale of flavors. And if you're going to work on that, it's got to include mint and menthol. That's very important. Cannot be saying teens are not using those flavors. They are. We can also push age verification. And if the feds don't do it, you can do it at the state and local level. California did. We actually passed a law that was more like alcohol. You have to be 21 or over. You have to show ID. You have to be there. You can't just leave the packages. That can be done to you can also eliminate the sale of e-cigarettes in your areas. They are tobacco products. They should be considered a tobacco product. They should be taxed like tobacco products and regulated like tobacco products. So all those things can be done at the state and local level. So to end with some resources, we don't have FDA-approved nicotine replacement therapy for teens who are addicted, but a lot of healthcare providers are still giving patches and gum and lozenges because you can still write them off-label. For teens, you can prescribe it. So a lot of healthcare providers are doing that to help addicted teens come off of these products because they are so high in nicotine. A lot of times they need some form of nicotine. But there are also other resources. There are a lot of online and texting resources. Some of them are here, Become an X, or This is Quitting from the Truth Initiative, and then American Lung Association, Surgeon General has. And then we have the Tobacco Prevention Toolkit. I don't make any money for this. I'm not selling you anything. This is a completely free resource on our website at Tobaccopreventiontoolkit.Stanford.edu. We have lots of activities and information and slides and fact sheets that you can use. You're absolutely welcome to use them any way you want. And some of the slides I've been using today, we just ask that you keep our logo and our website on there. But please, for your advocacy and education efforts, please feel free to use this. We will be in the next few weeks coming out with a healthcare provider website that's going to have, instead of an hour-long PowerPoint for you to talk to schools or parents, there'll be a 30-second information that you can use in healthcare provider offices and more information on motivational interviewing and cessation tools. So stay tuned for that. So in summary, it's really a perfect storm to addict youth. They're stealth, very youth-focused products. They're cool. They're neat-looking. They're very high in nicotine. Again, anywhere from 1 to 2 packs worth of cigarettes worth of nicotine. They're salt-based now, so they're less throat hit, easier to use. There are misperceptions. Teens are so confused about these products and the harm that they cause. They come in flavors that are very attractive to youth, and packaging and ads that are attractive and misleading. And they're cheap, and these products are harmful to anybody, and particularly to youth who are not using any other nicotine product. Thank you very much, and happy to answer any questions.
Thank you, Dr. Felsher. This is Neil. I don't know, can you hear me?
I can hear you. You can hear me still?
I can hear you. Thank you. I do have a question that came through for you. And anybody who has any questions, please use the Q&A function on your chat, on your Teams platform. I'm going to change this a little bit. Do you see any of this FDA regulation stuff to change with a newer administration coming in DC?
It's a very good question. I think it will, because what I already do know, have a little bit of intel that President-elect Biden has been looking into the drug and drug enforcement and drug abuse overall. So I think he may be open to it. It's certainly not going to be the first priority. We have other issues that we have to deal with, obviously, right now. But there is some thinking that he is going to be looking at e-cigarettes. Whether he's going to put pressure on the FDA is really difficult to know. You know, the tobacco company, the tobacco market has a very, very well-funded lobbying effort in DC right now, and at the city and state levels as well. But I would not rely on the FDA or the federal government to be regulating or doing much about the vaping industry right now. I think we do need to be doing a lot more work at the city and state level.
Thank you. Any other additional questions anybody has? Someone is asking, do I understand it correctly that THC is in most e-cigs?
No, sorry, that is not what I was saying. I was saying that THC is in a lot of the vaping devices that seem to be leading to EVALI, the e-cigarette vaping associated lung illness. In other words, teens and adults who are sick with EVALI seem to be using a marijuana device or a vaping device with marijuana and not necessarily nicotine. But most e-cigarettes have nicotine in them. Hopefully that clarified that.
Dr. Halpern-Felsher, has your research looked into changing patterns of use during the pandemic?
It has, and that paper's coming out in a couple of days, so I'm not supposed to talk about it a lot because it's an embargo issue. So if you email me, but yes, we have, and we are seeing some changes and important changes. So it's always that awkward thing where the journal says, don't talk about your data yet. But yes, we do have it coming out in a couple of days, and I think you're going to be interested in it and some important changes that are coming on.
Okay, thank you. We'll make sure we share that when that becomes available. What snapshot products are available to distribute to parents? They need a quick visual that we can present for their learning.
Snapshot of the issues?
Snapshot products. I don't know if there's something.
I'm not sure I know what a snapshot product is. Can somebody clarify that for me, please? Is it a new product that I haven't heard of?
A snapshot, I think, is just something brief.
A material for them. Okay,
yes.
Got it. Yeah. So if you look on our website, we do have fact sheets and we do have slides that parents can definitely use. And if you email me, I can easily point you to some of those materials. There are other organizations as well. There's PAVE, Parents Against Vaping E-Cigarettes, that has materials specifically for parents. And then we also have a similar talk to this one, a little shorter version recorded that you can also look at, that's on our website as well. So we do have materials there. Also, the Truth Initiative also has some information for parents. FDA does as well. The Truth Initiative does, and the CDC. So there are a lot of different websites where you can find parent information. But if you email me, I can easily help you find that information.
Great. What message works best with youth to encourage them not to use ENDS products?
It's a good question. Yeah. What you don't want to do is over scare them. Scare tactics we know don't work. What works is the truth. So if you say to a teen, if you vape, you're going to get lung cancer. First of all, we don't know that for sure yet, even though there's some hints at it, but also they don't care about what happens to them in 20 years or 50 years. They care about now. So talk to them first about the harms. Teens really don't understand the harms. So give them that information. Don't lecture, but say, these really aren't harmless devices, and I want you to understand that. What works most is to talk to them about the harms now. So if you talk about lung health, especially if, say, you have an athlete or somebody who's an active teen, to say it's going to be harder for you to run, it's going to be harder for you to play sports if you use these devices. That we do know. That works very well because that's tangible for a young person. If you can also talk about the fact that they're being manipulated, teens don't want to be duped. They hate that. So if you can say, look, these flavors, these products are not for us adults. They're attracting you. And they're attracting you from the same companies who brought us cigarettes. We're looking at Altria. Juul now is owned, 30% of Juul is owned by Altria, which is Philip Morris. So if you can say, look, these companies are being owned by the same companies who brought you tobacco and who lied about the nicotine and the other components that are in cigarettes. It's the same companies, and they're lying to you again. And they're trying to get you attracted to these products by not explaining how much nicotine is in there, by not explaining that even the flavors can be harmful. That tends to work with young people as well. So here and now, not just the health effects, but them being manipulated and things that affect them right now tend to be very, very helpful and important to teens.
What do you say when people ask you about the vapes that have caffeine or essential oils or melatonin? We are seeing an uptick in them, and teens see them as safe.
Yes, we actually are just going to be putting some information and fact sheets on those products on our website very soon, because that's been a question we get a lot. First of all, we don't have a lot of research on those products. That's part of the problem. But I will go back to lung health and anything we vape. Anything you vape and heat up and vape into your lungs, breathe into your lungs, is harmful. So whether it's melatonin, to help you relax at night and sleep, you're still breathing in the chemicals. Those products are probably using something to bind to it to allow it to come into your body, whether it's vitamin E acetate, whether it's propylene glycol or glycerin, or the flavors themselves, something in there that they're binding, some oil that you're not supposed to breathe into your lungs. So we very much worry about those. It's not the melatonin itself, it's not the caffeine itself, it's the delivery device and the chemicals that are put into that device that makes us worry. There's also some evidence that we're breathing in really little pieces of plastic and metal from this device that could also get deep into your lungs. So all of those components make us, in my lab, and I work a lot with an adolescent medicine physician, and we talk about this, and he says the same thing. We're just worried about vaping, breathing in anything into your lungs.
Thank you, Dr. Halpern-Felsher. We don't have any additional questions coming in right now. This was fantastic information. Want to thank you so much for being a part and for helping us kick off this series. We will be using your information and be looking forward to additional information coming out from you. This is going to help us determine how we move forward with our work, and I hope that this information has been helpful to everybody that's been able to attend. So thank you, Doctor, for being a part of this today with us in North Dakota.
You're welcome, and thank you, and please do let me know if you want anything or need anything that I can further help you with.
Great. Thank you.
Thank you.